DHEC has now confirmed 2 cases of monkeypox in the state. One of those cases here in the Midlands. News 19's Zoe Henry spoke with a health expert who answered some of your questions about the virus.
The surge in monkeypox infections in the U.S. has reached South Carolina. News 19 spoke with Dr. Linda Bell, the state epidemiologist with DHEC, about some of your concerns.
This is actually not a new virus because it has been occurring endemically in some West African countries for quite some time.
Police is a Columbia resident who says she's seeing claims floating around like what the virus is.
Well, I heard so far it's like a herpes. So it's like basically when you have an intimacy with somebody, you can catch it that way.
Dr. Bell says this disease isn't necessarily categorized as a sexually transmitted disease or STD, but it is primarily transmitted through skin-to-skin contact.
Close, prolonged direct contact with those who are infected or articles that they may have been exposed to their skin lesions.
As far as treatment for the disease,
you have to take like an antibiotic or something like that.
Dr. Bell says to cut the spread, there's a similar solution to COVID-19.
We have had occasional clusters in the states in the past that have been successfully interrupted with what we call ring vaccination around cases.
As for concerns with how big this virus is compared to COVID-19, some worry it's not as contagious.
We are not expecting this to evolve the way that the COVID pandemic did because it's not spread from person to person, primarily by the respiratory route.
What can I do to stay safe?
Dr. Bell says the #1 thing is monitor unusual rashes, avoid contact with sick people, and sharing things like clothes and towels. In Columbia, Zoe Henry, News 19, WLTX.
DHEC also says the general public is at a low risk for contracting the monkeypox virus.